Studying for your medicine interviews, making sure that you know all of the content and are keeping up to date with all of the topics and world events that are happening can sometimes feel really overwhelming. But in this video, I'm going to simplify for you what antibiotic resistance is and antigenic variation, what their current role is, their history, and everything that you need to know so you can talk about them critically and analytically in your medical school interviews. Hi, I'm Loveleen, a medical student at King's College London, here to help you with your interviews. Now, I completely understand how daunting and difficult interviews were, as I was in your position. But fast forward a couple of months, I went on to achieve all 4 of my offers with interview scores as high as 135 out of 140. And I'm here to help you do the same and achieve your dream of studying medicine. On my channel, I talk about all things relating to medicine, entrepreneurship, and mindset. Now, to help you, I've also created loads of different resources. First up is my Aspiring Medics newsletter for completely free resources. On this, I post loads of different tips relating to the journey of getting into medicine, especially around during UCAT season and interview season, and what you can be doing to help you achieve your dream of studying medicine. Additionally, one of the key reasons that I was actually able to get all 4 of my offers was my interview document. This is an over 50-page document in which I've included all of the content that you need to know, ethical pillars, over 100 different types of questions, and also the NHS hot topics and research. If you're interested in this, make sure to check it out using the link below. Additionally, if you want more personalized support with helping you get your 4 out of 4 offers and studying medicine at your dream uni, then check out my interview course. Again, as part of this interview course, you get personalized, tailored learning given to you about all the content, learning how you should actually be structuring your interview responses, what your interviewers want from you when you're doing a med school interview, and the art of speaking and presentation, because this is so important in helping you secure your offers and get into medicine. Since the discovery of antibiotics, they've often been used for many different conditions, especially infection ones that are bacterial, and they've been highly effective and can significantly reduce death rates from these infectious diseases and are highly beneficial and important in medicine today. Antibiotics are actually essential in the treatment for bacterial infections. However, many antibiotics may no longer be effective against different bacteriums. This is because bacteria has the ability to mutate, which means it can change its DNA and develop something called antibiotic resistance. What antibiotic resistance means is that that specific antibiotic that is being used against that bacteria may no longer be affected. So if someone is infected with a bacterial disease or bacterial infection, for example, giving that antibiotic may no longer be effective because that bacteria is actually able to withstand and survive within the presence of that antibiotic. Antibiotic resistance is one of the problems that has been growing in frequency, and typically in hospitals, doctors could actually prescribe multiple different medications and antibiotics in the hopes that at least one of them will be able to target the bacteria. One of the reasons that antibiotic resistance has actually started to develop is due to the overuse of different antibiotics. For example, a lot of the time livestock are administered antibiotics, and this is needed to prevent them from having infections in the first place, but as a result they're often given a high amount of antibiotics. Additionally, there has also been shown that within hospitals and GP settings sometimes there is an overprescription of antibiotics, and they can also be given when not needed. For example, antibiotics are not actually effective against viral infections, only against bacterial, but even still there are instances where patients believe that by taking antibiotics even with a viral disease can be beneficial, but this is not true. Antibiotics only work against bacterial infections, which is why they should only be used in instances where required. As a result, because of the overuse of antibiotics, this has actually led to more antibiotic resistance within bacteria. Additionally, when antibiotics are typically prescribed, patients have to follow a course and complete the entire course of antibiotics. However, if a patient stops taking the antibiotics before they should, what can happen is some of the bacterium can actually survive. They mutate and then become resistant to this bacterium. This is why it's really important, and doctors always highly recommend that you need to actually finish your course of antibiotics. If too many bacteria actually become resistant to different antibiotics, it becomes harder to treat them. Currently, there are different solutions that are being presented to ensure that antibiotic resistance does not continue to grow. Firstly is that there are restrictions being placed on farmers onto how much antibiotics they can use on livestock. Secondly is improving education in terms of hand washing and other hygiene habits to reduce infection rates in the first place. And thirdly is improving education to make sure that antibiotics are not being overprescribed and only in instances where they truly are needed. Something else that is also being considered is just developing new drugs or therapies in order to be able to target bacteria. This may be through finding new drugs and medications, or just by targeting and killing bacteria through a different mechanism. Again, there are loads of different researches that are being trialed as well, and you could actually go ahead and look at one of these in detail so you can talk about them. But also suggesting this idea in your med school interviews and saying that conducting more research in this, or even using AI to help accelerate the development of different ways of targeting bacteria, could be really beneficial. And the final thing to talk about is something called antigenic variation. Now, antigenic variation is not the same as antibiotic resistance. In antibiotic resistance, what the bacterial cells are doing are actually modifying the DNA, which means that any bacteria that then replicates also has that change. What antigenic variation is when the proteins on the outside of that molecule are actually being changed, which means that the molecules on the outside of each surface are different. The reason that microorganisms actually change the molecules on the outside, so the different proteins that are on the surface, is to evade the immune system. This means that they're not detected as easily, so then they can essentially continue to grow and thrive within whatever host body that they are in. Hopefully this video has given you much greater understanding into both antibiotic resistant and antigenic variation. Antibiotic resistant is definitely the one that is more likely to come up in your interviews and the one you need to be able to talk about, which is why I've put a focus on that in this video. However, antigenic variation is still something that could potentially be mentioned, or by you yourself including it in your answers. It just shows that wider reading that you've done. I hope this video definitely helps, and make sure to check out the rest of my videos on my YouTube channel, as I have them on all of the different NHS hot topics and the content that you need to do well in your medical school interviews.